Hey everyone, my name is Dr. Galatia Strong. I am a physical therapist who got a 100% on my NPTE, and this led me to co-found SPTwithMe, which is an online NPTE study platform. If you end up enjoying this video and feel like it was beneficial, please feel free to check out our courses at SPTwithMe.com for our full NPTE studying experience, designed to guide you towards acing your test. Now, onto what you're actually here for. Let's talk about temporomandibular joint dysfunction. Let's get this straight. We'll move past it. It's TMJD, not TMJ, okay? Everyone has a TMJ, but not everyone has a TMJD. Moving on. Why is the TMJ so intimidating for not only student physical therapists, but physical therapists as well? If you actually take the time to consider what's going on, it's just like any other body region. You have muscles, you have bones, you have the expected roll and slide, range of motion, etc. In this video, we will go over the basics about TMJ to make it a little bit more manageable. There's definitely a lot more information than what is mentioned, but the following pieces of information is what I truly believe can help you grasp this body region a bit better. Let's talk about muscles first. Which ones are involved? Again, big picture, there are more than these listed. The masseter, temporalis, and medial and lateral pterygoid muscles are the major muscles to consider with respect to TMJ. Flexibility and/or strength deficits may cause imbalances that result in pain. That's just in general, right? It's not just with TMJD. For example, let's say you are assessing lateral excursion, right? You move your mandible to the side, and you observe that the active range of motion to the left side is more than that of the right, right? You have some asymmetries going on. Could be a joint issue, could be a strength issue, maybe it has to do something with weak contralateral pterygoids, right? We got to figure it out. Now, if you don't have the brain space to memorize each function of all the muscles, the ones on this slide, the bolded ones, are a good starting place. Just like how the tricep muscle is more universally known to be an elbow extensor versus both of its duties, it's both an elbow and shoulder extensor, kind of the same thing goes with the pterygoid muscles. They're just better known for their involvement in contralateral lateral excursion more than their involvement with protrusion or grinding movements. They do all of it, however, it's just more, universally known. Now, knowing at least the more well-known actions can assist you in your clinical reasoning with this body region. Here's a picture of the muscles: masseter, temporalis, medial and lateral pterygoids. Mechanics, joint mechanics. So, roll, slide, glide, etc. The TMJ, it rolls and glides. However, it's not at the same time. The first part of the movement, mandibular depression, this involves rolling. The remainder of the movement involves anterior translation of the mandibular condyles, right? There's two, it's not just one joint. At least that's what's normal, right? When we do have something going on, something's not right, then yes, maybe one doesn't roll, one does roll, right? But let's get into what's normal first. So with this information, observing and palpating the quality of movement can be very telling as to how to approach treatment interventions. So if you notice a person's mandibular condyles, right, you have them open and close, even side to side, whatever movement, if you notice that their condyles skip the rolling part and instead immediately translate anteriorly, remember there are two parts, right, rolling first, then translation. If you notice that they skip the first part and go to the second part, as they open their mouth, you should be aware that this is not normal, right? We have expectations of what should happen, so anything straying away from that is abnormal, just like any other body region. That's what we would expect. However, finding the cause of this deviation, that's the next step. So this is a picture showing the roll, then the anterior translation. Talk about some bony structures that are involved. So there are two that are bolded, the mandibular condyle and the temporal bone. These two, I would say, are the two main bones that you should consider with the TMJ. Now, the other ones that are listed, the maxilla, hyoid bone, zygomatic bone, these are involved because they serve as attachment sites to the muscles that act on the mandible. Range of motion. So just like with other body regions, right? Range of motion findings, if it's excessive, if it's normal, if it's decreased, all this information can assist us with identifying the diagnosis and potential source of symptoms. So it's nothing new. Is it normal or is it not? Even though this slide says unique features, understand that all other body regions have unique features as well, okay? With respect to the TMJ, some unique features include the articular disc, along with the hyoid bone and its associated infrahyoid and suprahyoid muscles. So let's talk about the articular disc. The articular disc is an extension of the joint capsule that sits between the temporal bone and the mandibular condyle. Now let me take out my highlighter and we're going to highlight where exactly that is. So if you take a look at the two columns that we have, the 3 rows, 2 columns, look at the very top left one. That's the normal disc position, okay? I'm going to highlight the actual disc. This is what it is, this area right here. I think I've covered it up completely. But so when we open our mouth, the disc should move and it should stretch with the movement of the mandibular condyle during the anterior translational movement. So if we go to the right, let's look at this right arrow here, right? So we have our jaw closed, then when it opens, you see that this disc moves with the mandibular condyle. This is normal, okay? The problem is that the disc can get malaligned. So if you look at the bottom 2 figures, I'm going to highlight it again, you can see that compared to the top image, so if I erase this because I know it's covering it a little bit, compared to the top image, the middle image is slightly anterior to the mandibular condyle. The bottom image again is slightly anterior to the mandibular condyle compared to the normal, right? So let me erase it so you can see it a little bit better. Now, when it is in this malaligned position, just right in front of the mandibular condyle, it may cause the condyle to just get stuck behind the disc. And as a result, it might not be able to translate anteriorly at all. Or if it does, it can go over it just super fast, like speeding over a speed bump, which can then cause a clicking sound that a lot of people might complain of. Either way, both of these scenarios can cause pain. So let's look at the 2 examples. So if you look at the one right under the normal one, the disc displacement with jaw clicking, like I just mentioned. Again, now both of these, they start in the same position, right? Just the result of it, whether or not the condyle can actually go over it, is a different story. So if we look at the disc displacement, this one right over here, with jaw clicking, you can see that again, it starts right in front of it, but as the condyle moves forward, it's actually able to sneak right under the articular disc, so still can get that movement. However, the next example, the very bottom one, disc displacement with jaw locking without reduction, again, it starts exactly where this one had started, but the problem is the condyle is not able to go underneath that articular disc. It is just jammed right behind it. Let's talk about some considerations. Again, just like other body regions, it is important to consider surrounding areas, nothing new. For example, the shoulder, you might not just get the full picture if you only look at the glenohumeral joint. However, you look at the cervical spine, the sternoclavicular joint, the scapulothoracic joint, the thoracic spine, the acromioclavicular joint. You get the point. You can obtain a lot more information that might tell you what is causing their symptoms, why they're presenting the way they are with you. With the TMJ, look at the cervical spine, the thoracic spine. We should know that forward head posture throws many body regions out of alignment, right? And it can create dysfunctions. Same thing with respect to its effect on the TMJ. If you look at the infrahyoid and suprahyoid muscles, forward head posture is going to alter the length of these muscles. Thus, pulling on the hyoid bone which pulls on the mandible, which affects the TMJ. I am sure that I am just annoying you at this point. The TMJ is a joint with muscles. It has ligaments, it has capsules, bones, etc. You find impairments and you treat them. Is it a muscle issue? Is it a joint issue? Hypomobility? Motor coordination? Find out, and that's how you treat it, okay? Once again, I hope this video was helpful. I hope things are a little bit more manageable with TMJ. I know it is a scary subject. A lot of schools don't really cover it all too much, but I hope this kind of puts everything together. Again, I instruct the courses on SPTwithMe.com. We have more than 6 hours worth of content that is specifically designed to get you to pass and ace your NPTE just like I did. Leave comments, questions, feedback. It's all appreciated. Stay on the lookout for more videos by subscribing. If you still feel stuck, here are the references. They're very, very helpful. I shall see you next time.